Omega-3 fatty acids have been linked to many health benefits. In particular, they may help promote brain and heart health, reduce inflammation, and protect against several chronic conditions. Omega-3 fatty acids are incredibly important. They have many powerful health benefits for your body and brain. In fact, few nutrients have been studied as thoroughly as omega-3 fatty acids. Here are 17 health benefits of omega-3 fatty acids that are supported by science. 1. May benefit depression and anxiety. Depression is one of the most common mental disorders in the world. Symptoms often include sadness, lethargy, and a general loss of interest in life. Anxiety, another common disorder, is characterized by feelings of fear, panic, and restlessness. Interestingly, studies indicate that people who consume omega-3s regularly are less likely to have depression. What's more, studies in people with depression and anxiety suggest that omega-3 supplements may improve symptoms. There are 3 types of omega-3 fatty acids: alpha-linolenic acid, ALA, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA. Of the 3, EPA appears to be the most beneficial for depression. Summary: Omega-3 supplements may help treat and prevent depression and anxiety. EPA seems to be the most effective at reducing symptoms of depression. 2. May improve eye health. DHA, a type of omega-3, is a major structural component of the retina of your eye. When you don't get enough DHA, vision problems may arise. Interestingly, getting enough omega-3 is also linked to a reduced risk of macular degeneration, one of the leading causes of permanent eye damage and blindness around the world. Summary: An omega-3 fatty acid called DHA is a major structural component of your eye's retinas. It may help prevent macular degeneration, which can cause vision impairment and blindness. 3. Could promote brain health during pregnancy and early life. Omega-3s are crucial for brain growth and development in infants. Getting enough omega-3s during pregnancy is associated with numerous benefits for your child, including improved cognitive development, better communication and social skills, fewer behavioral problems, decreased risk of developmental delay. However, keep in mind that more research is needed, as some studies have turned up mixed results. Summary: Getting enough omega-3s during pregnancy and early life is crucial for your child's development. Omega-3 supplementation is linked to improved cognitive development and a lower risk of developmental delay. 4. May improve risk factors for heart disease. Heart attacks and strokes are the world's leading causes of death. Decades ago, researchers observed that fish-eating communities had very low rates of these diseases. This was later linked to omega-3 consumption. Since then, omega-3 fatty acids have been tied to numerous benefits for heart health. These benefits include triglycerides. Omega-3s can significantly reduce levels of triglycerides. HDL cholesterol. Some older studies suggest that omega-3s could raise HDL, good cholesterol levels. Blood clots. Omega-3s can keep blood platelets from clumping together. This helps prevent the formation of harmful blood clots, according to some older research. Inflammation. Omega-3s reduce the production of some substances released during your body's inflammatory response. For some people, omega-3s can also lower LDL, bad cholesterol. However, evidence is mixed, as some studies find increases in LDL cholesterol levels. Despite these beneficial effects on heart disease risk factors, there is no convincing evidence that omega-3 supplements can prevent heart attacks or strokes, and many studies find no benefit. Summary: Omega-3s may help improve numerous heart disease risk factors. However, omega-3 supplements do not seem to reduce your risk of heart attack or stroke. 5. May reduce symptoms of ADHD in children. Attention deficit hyperactivity disorder, ADHD, is a behavioral disorder characterized by inattention, hyperactivity, and impulsivity. Some research has found that children with ADHD have lower blood levels of omega-3 fatty acids than those without ADHD. What's more, numerous older studies suggest that omega-3 supplements could help reduce the symptoms of ADHD. In particular, omega-3s may help improve inattention and task completion. They might also decrease hyperactivity, impulsiveness, restlessness, and aggression. However, more research is needed, as other studies have found no benefit of omega-3 supplementation on ADHD symptoms. Summary: omega-3 supplements may help reduce the symptoms of ADHD in children. However, more research is needed, as studies have turned up mixed results. 6. Could reduce symptoms of metabolic syndrome. Metabolic syndrome is a collection of conditions. It includes central obesity, also known as belly fat, as well as high blood pressure, high triglycerides, high blood sugar, and low HDL, good cholesterol levels. It is a major public health concern because it increases your risk of many other illnesses, including heart disease and diabetes. Some research suggests that omega-3 fatty acids could help improve blood sugar levels, inflammation, and heart disease risk factors in people with metabolic syndrome. Summary: omega-3s may have numerous benefits for people with metabolic syndrome. They could improve blood sugar levels, reduce inflammation, and improve several heart disease risk factors. 7. May reduce inflammation. Inflammation is a natural response to infections and damage in your body. Therefore, it is vital for your health. However, inflammation sometimes persists for a long time, even without an infection or injury. This is called chronic or long-term inflammation. Long-term inflammation can contribute to almost every chronic illness, including heart disease and cancer. Notably, omega-3 fatty acids can reduce the production of molecules and substances linked to inflammation, such as inflammatory eicosanoids and cytokines. In fact, studies have consistently observed a connection between omega-3 supplementation and reduced inflammation. Summary: omega-3s may reduce chronic inflammation, which can contribute to heart disease, cancer, and various other diseases. 8. Might benefit autoimmune diseases. In autoimmune diseases, your immune system mistakes healthy cells for foreign cells and starts attacking them. Type 1 diabetes is one prime example, in which your immune system attacks the insulin-producing cells in your pancreas. According to one study, increased intake of several types of fatty acids during infancy, including DHA, was linked to a lower risk of type 1 diabetes-associated autoimmunity later in life. 51. Omega-3s may also help treat lupus, rheumatoid arthritis, ulcerative colitis, Crohn's disease, and psoriasis, but more research is needed. Summary: omega-3 fatty acids may help treat and prevent several autoimmune diseases, including type 1 diabetes, rheumatoid arthritis, ulcerative colitis, Crohn's disease, and psoriasis. 9. Could improve mental disorders. Low omega-3 levels have been reported in people with psychiatric disorder. Interestingly, supplementing with omega-3 fatty acids has been shown to decrease violent behavior. Some studies also suggest that omega-3 supplements can improve symptoms in people with both schizophrenia and bipolar disorder. However, more research is needed, as other studies have turned up conflicting results. Summary: people with mental disorders often have low blood levels of omega-3 fats. Improving omega-3 status seems to improve symptoms, but more studies are needed. 10. May help prevent age-related mental decline and Alzheimer's disease. Many people experience a decline in brain function as they get older. Several studies link higher omega-3 intake to decreased age-related mental decline and a reduced risk of Alzheimer's disease. One review of controlled studies suggests that omega-3 supplements may be beneficial at disease onset, when the symptoms of AD are very mild. Keep in mind that more research is needed on omega-3s and brain health. Summary: omega-3 fats may help prevent age-related mental decline and Alzheimer's disease, but more research is needed. 11. May help prevent cancer. Cancer is one of the leading causes of death in the United States, and omega-3 fatty acids have long been claimed to reduce the risk of certain cancers. In fact, some older studies show that people who consume the most omega-3s have up to a 55% lower risk of colon cancer. Additionally, omega-3 consumption is linked to a reduced risk of prostate cancer and breast cancer in some older studies. However, not all studies have reported the same results. Summary: omega-3 intake may decrease the risk of some types of cancer, including colon, prostate, and breast cancer. However, more research is needed. 12. Could reduce asthma in children. Asthma is a chronic lung disease with symptoms like coughing, shortness of breath, and wheezing. Severe asthma attacks can be very dangerous. They are caused by inflammation and swelling in the airways of your lungs. What's more, asthma rates in the United States and around the world have been rising over the past few decades. Interestingly, several studies associate omega-3 consumption with a lower risk of asthma in children. Summary: omega-3 intake has been associated with a lower risk of asthma in children. 13. May reduce fat in your liver. Non-alcoholic fatty liver disease, NAFLD, is a common condition characterized by the accumulation of fat in the liver. It is believed to affect 25% of the global population and is considered the leading cause of several other liver conditions, including cirrhosis or liver scarring. However, research suggests that supplementing with omega-3 fatty acids may help reduce liver fat and inflammation in people with NAFLD. Summary: omega-3 fatty acids may help reduce liver fat in people with non-alcoholic fatty liver disease. 14. May improve bone and joint health. Osteoporosis and arthritis are two common disorders that affect your skeletal system. Research suggests that omega-3s may help improve bone strength by boosting the amount of calcium in your bones. Theoretically, this should lead to a reduced risk of osteoporosis. However, more research is needed, as studies have turned up mixed results on the effects of omega-3 fatty acids on bone health. Omega-3s may also help treat arthritis. According to one review of 6 studies, omega-3 supplements were able to significantly reduce pain in people with osteoarthritis of the synovial joints. Still, more large, high-quality studies should be conducted to understand how omega-3 fatty acids may impact bone and joint health. Summary: omega-3s may improve bone strength and joint health, but more research is needed. 15. Might help alleviate menstrual pain. Menstrual pain occurs in your lower abdomen and pelvis and often radiates to your lower back and thighs. It can significantly affect your quality of life. However, studies repeatedly suggest that people who consume the most omega-3s may have milder menstrual pain. One 2011 study even determined that an omega-3 supplement was more effective than ibuprofen in treating severe pain during menstruation. Summary: omega-3 fatty acids might help reduce menstrual pain. Plus, one study found that an omega-3 supplement was even more effective than ibuprofen, an anti-inflammatory drug. 16. May improve sleep. Good sleep is one of the foundations of optimal health. Sleep deprivation has been linked to many diseases, including obesity, diabetes, and depression. In some older studies, low levels of omega-3 fatty acids were also associated with sleep problems in children and obstructive sleep apnea in adults. Additionally, low levels of DHA are linked to lower levels of the hormone melatonin in some animal studies, which helps you fall asleep. However, further research in humans is needed. Studies in both children and adults also suggest that supplementing with omega-3 may improve certain aspects of sleep and could protect against sleep disturbances. Summary: omega-3 fatty acids, especially DHA, may improve the length and quality of your sleep. 17. Could support skin health. DHA is a structural component of your skin. It is responsible for the health of cell membranes, which make up a large part of your skin. EPA also benefits your skin in several ways, including Promoting skin hydration. Preventing hyperkeratinization of hair follicles, which appears as the little red bumps often seen on upper arms. Protecting against premature aging of your skin. Reducing the risk of acne. Animal studies suggest that omega-3s may also help protect your skin against sun damage. However, keep in mind that this doesn't mean that you should use omega-3 supplements in place of sunscreen. Summary. Omega-3s can help keep your skin healthy, preventing premature aging and safeguarding against sun damage. The bottom line. Omega-3 fatty acids are vital for optimal health. Getting them from whole foods, such as fatty fish 2 times per week, is the best way to ensure robust omega-3 intake. However, if you don't eat a lot of fatty fish, then you may want to consider taking an omega-3 supplement. For people deficient in omega-3, this is an affordable and effective way to improve health. The watching, interacting, and participation of any kind with anything on this page does not constitute or initiate a doctor-patient relationship with verypudic.com. None of the statements here have been evaluated by the Food and Drug Administration, FDA. The products of verypudic.com are not intended to diagnose, treat, cure, or prevent any disease. The information being provided should only be considered for education and entertainment purposes only. If you feel that anything you see or hear may be of value to you on this page or on any other medium of any kind associated with, showing, or quoting anything relating to verypudic.com in any way at any time, you are encouraged to and agree to consult with a licensed healthcare professional in your area to discuss it. If you feel that you're having a healthcare emergency, seek medical attention immediately. The views expressed here are simply either the views and opinions of verypudic.com, others appearing and are protected under the First Amendment. Verypudic.com promotes evidence-based natural approaches to health, which means integrating her individual scientific and clinical expertise with the best available external clinical evidence from systematic research. By individual clinical expertise, I refer to the proficiency and judgment that individual clinicians acquire through clinical experience and clinical practice. Verypudic.com does not make any representation or warranties with respect to the accuracy, applicability, fitness, or completeness of any multimedia content provided. Verypudic.com does not warrant the performance, effectiveness, or applicability of any sites listed, linked, or referenced to, in, or by any multimedia content. To be clear, the multimedia content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health providers with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have read or seen in any website, video, image, or media of any kind. Verypudic.com hereby disclaims any and all liability to any party for any direct, indirect, implied, punitive, special, incidental, or other consequential damages arising directly or indirectly from any use of the content, which is provided as is, and without warranties.